Hello, I'm Colleen Gallagher, CEO at OnWrd and UpWrd, and you're listening to the Association Insights podcast, where each week we interview association leaders from across the country to hear how they're trying new things, taking big risks, and delivering value for their members. We'll explore the realities of what it means to work in and with associations and bring you the insights and inspiration you need to advance your career and make big changes at your association. Let's get started.
Welcome back to the Association Insights podcast. I'm your host, Meghan Henning. Today we're talking with Julie Hirschhorn, Manager of Public Relations at the American Academy of Family Physicians, or AAFP. If you work in healthcare advocacy or communications, you know just how critical trusted voices have become. And AAFP has long stood at the center of that trust. Julie and her team recently earned a Com Impact Award for their bold, compassionate, and highly strategic campaign around National Immunization Awareness Month. At a time when vaccines have become increasingly politicized, AAFP leaned into the credibility of family physicians to reframe the narrative and reach families with empathy and clarity. We'll dig into what made this campaign so impactful, from the messaging strategy to media outreach, and what other associations can learn as they navigate polarizing issues with grace and purpose. So welcome, Julie.
Thank you so much for having me.
So to start us off, can you give listeners just a quick snapshot of your mission, who you serve, and the role communications and advocacy play in supporting family physicians and communities they care for?
Of course. So the American Academy of Family Physicians represents almost 130,000 family physicians, residents, and medical students across the country. And I always say that it takes a really special person to be a family physician. They do everything. They are taking care of patients from who are newborns to seniors. They are doing preventive care like vaccines, cancer screenings, eye exams. And they also even deliver babies and provide a safe space for people to talk about sensitive issues, including mental health. So they are truly superheroes. And I think throughout history, and especially since the COVID-19 pandemic, we have seen family physicians rise up again and again and meet the moments at a time when healthcare is especially in the news and is getting a lot of headlines and attention. So family physicians are really trusted voices. When you think of who in your community do you trust with your healthcare, it's going to be your family physician, who is also likely your first point of entry into the healthcare system.
Yeah, that's great. So let's dig into your award-winning campaign. The National Immunization Awareness Month is something that you have participated in for years. But 2025 was a very different environment. What made you realize this moment required a more intentional and elevated communication strategy?
Yeah, absolutely. So we know that flu season happens every year. We're getting COVID seasonally, but there's been a lot more attention around vaccines and in the headline. And our philosophy is that if healthcare is being discussed, then a family physician should be at the table and part of the conversation. And the AAFP's mission does not shift with any political ties. It doesn't shift with headlines. If the science hasn't changed, then neither will we. So we recognize that this year's Immunization Awareness Month was a really crucial time to reiterate to all of our audiences that vaccines are safe, effective, and save lives, and none of that science has changed. So when I think about our public messages about health, they're really kind of targeted into three main audiences, and this is what we had done during Immunization Month. The first is AAFP members, so the family physicians, medical students, and residents who are across the country. We were working to ensure that they had the resources that they needed to communicate to their patients the importance of getting vaccinated and protecting that community that they're in. And we did this in a couple ways through earned media and making sure that our spokespeople were in outlets across the country talking about what they're doing to improve access to vaccines, to have those conversations, and also making sure that the content that we're doing is resonating with our members. The second part is the public and reminding people that their family physician is a trusted community partner in their healthcare, and that the medical information that they're sharing to their patients is rooted in science and evidence and not opinion or rhetoric. And then the third we think of are policymakers, so the people in agencies and in state and national and local government, and informing lawmakers how misinformation is impacting physicians and their ability to inform policy decisions.
That's amazing to be able to break it down and to think of all of the aspects because, to be honest, as a person in the community with a family physician, when all of this was taking place, it was overwhelming, right? I mean, there was so much information coming at you from different places. And we know that a lot of people get some of their medical knowledge, and I'm putting that in quotation marks, from TikTok and from social media. And so I think that you bringing this down into the three core audiences really helps your message. But the biggest thing that stood out to me in your campaign was, tone. How did your team think about tone? Specifically, like balancing that scientific accuracy that you mentioned, but with compassion, when shaping your core messages. I feel like, people talk about voice and tone all the time, but this is really, I feel like, the very first real world example where this is super important. So can you talk to us about that?
Yeah, and it's a great question. And as communicators, we are living in a time where tone and message is really important. And what I would like to start with is that family physicians, first and foremost, know that no patient or family member is coming into their office wanting to do they only want to do the very best thing for their health and their family's health. And so family physicians have been having these conversations for years and years, and they know that any form of vaccine hesitancy often comes from fear or confusion and not necessarily bad intent. Again, everyone wants to do the best for their families. So our messaging is really rooted in avoiding shame or alarmism, and instead focusing on those shared values that doctors and their patients share, protecting families, keeping communities healthy, and having honest conversations with a physician who knows you and your health history, which is really what family medicine is all about. And I think that balance really helps us cut through noise without escalating any polarization, without accusing people, and really keeping the message rooted in science and that people want to do the best to stay healthy. And having that conversation with your family physician is the best place to start. And then anchoring everything in evidence and leading with empathy, not jargon, not real messages. It can be difficult to get kind of bogged down in jargon about medicine and vaccination, but really hammering home with real messages from real people that are digestible in a way that patients and policymakers and the public can understand.
I think that's so smart. And you're right to point out that people are visiting their family physician and they do want the best, that they're probably clouded by confusion and misinformation. So that's such a good point, and it's such a good, thing to be able to recognize, because that is where your tone comes into play, along with your scientific evidence and all of that. So I love that. One of the standout elements of this campaign was centering around family physicians as the primary messengers. How did you activate and prepare your spokespeople, across national leaders and chapter voices and fellows to show up consistently and credibly in the media?
Yeah, that's a great question. I know that family physicians are on the ground across the country, seeing everything happen in real time, and they are responding and stepping up, and they're eager to speak out and share these stories. When we think of media interviews, when we think, or whether it's testifying in front of Congress, we know that family physicians have valuable lived and shared experiences that are really helpful in shaping the narrative. Oftentimes, family physicians live in the same communities as their patients, so they are really trusted and reliable messengers. And our media strategy focused on using family physicians as the main spokespeople, not only as voices of the AAFP, but also voices of their communities. And so we partnered with local, national, and regional and trade outlets to ensure that that information was accurate and coming from a family physician. We know from research that family physicians and doctors are among the most trusted sources of information. And we also know that more people are looking to local sources and media for their news. And so by placing real physicians in front of the camera or on the radio and in print, we're reminding audiences that credible and compassionate expertise is close to home. And so what does that mean? That is a lot of work behind the scenes. And that means equipping our chapters, our spokespeople, and family physicians with consistent and adaptable messaging that they can use. We do a media training every year. We provide talking points that are tailored to each interview and outlet, a lot of rapid response support, and then also sharing local data and research so that they can speak authentically from their own communities.
That's some great tactical things that I feel like listeners can really put into play, today if they're in this situation. You have, the campaign spanned the national outlets, as you said, the local media, because that seems to be a little bit more trusted, parenting publications, and you also did a bilingual satellite media tour, which I think is great. How did you decide where to focus your efforts? And what role did the local and community-based coverage play in building trust?
So we know that trust is local, and we really built our strategy around Immunization Month with that principle in mind. National outlets definitely help set the narrative, but local and community-based media is really essential for impact and relevance. Like I said, we know that more and more people are trusting their local news stations. So, whether it's getting a family physician on the local 4 p.m. news in South Carolina when there's a measles outbreak, and having that trusted voice, and reaching states where we're seeing outbreaks or places where vaccine hesitancy is higher. Getting that message from the ground and then spreading that is really important. And it's not just media interviews where you do that too. We've done campaigns where it's letter to the editor and local op-ed campaigns, where we have doctors submitting articles to their local newspapers talking about what they know and what they're seeing. And that kind of grassroots activation is really helpful in getting the message out there. When we think of parenting publications, that allows us to speak directly to parents and families and caregivers who are making real-time decisions about their health. The AAFP has a website called familydoctor.org. It's our patient-facing site, and that's where we have accurate, evidence-based, science-based information that is approved and written by family physicians, that is broken down in a very digestible way that your average family or person looking for health information can understand. And we know that having a trusted source of healthcare information is really important. So whenever we're doing those interviews, we also share familydoctor.org resources, because we know that our doctors are sharing those resources with their patients, and they're a good source for media to highlight as well. And then making sure that we're reaching everyone in different populations in different areas in different parts of the countries. So we did a bilingual satellite media tour, which was really critical for reaching Spanish-speaking audiences, with messaging that was culturally appropriate for them. And every channel that we use for this campaign plays a role in reinforcing that trust and accessibility, which is so important when we're talking about public health.
I think that's great. One of the things that stands out to me with this campaign is that it clearly went beyond reacting to misinformation, and it was really about reframing the conversation, which you were able to do. So, what did success look like for your team beyond placement numbers, and how do you know the messaging was landing?
Yeah, placement numbers really matter, but those are not always the whole story. And I think that this is going to be like, yes, we have National Immunization Awareness Month, but this work is continuing 24/7, 365. People are always going to have questions. They're always going to want to know more information. So this is a campaign that will really extend beyond just the month of August, which is historically National Immunization Awareness Month. So I think when we think about what success means, aside from, seeing a family physician quoted in the New York Times, it means seeing our messages repeated by physicians and journalists and community leaders on the ground. We're always paying close attention to the conversations that are happening in interviews and the tone of the coverage. And getting feedback from our own family physician members is also key. Are they having conversations from the information from this campaign that they can use directly with patients? Are we seeing them use those familydoctor.org resources? And, when we're thinking down the line, are we seeing more people getting vaccinated? I think the data will tell that story in the upcoming months and years to come. But when we see messaging and action moving from media interviews into exam rooms and into actual communities, that's when we see the real impact.
Right. So for associations that are navigating challenges like this or polarizing issues, what lessons from this campaign would you encourage them to apply? Like, especially when the public trust feels fragile?
I would lead first with your most trusted messengers. If you have people that are real people and on the ground and in the thick of things, it's always really helpful to hear their anecdotes and have them share their stories. And I think something that was a real lesson for us and is probably a lesson for other associations in healthcare and similar organizations is resisting the urge to be reactive. Framing the conversation is more powerful than chasing misinformation. So taking a step back and really reading the landscape in the room and taking that opportunity to figure out, okay, what is the most important thing that we need to respond to first, not just reacting, and how do we do this in a way that is aligned with the organization's mission and what our members are seeing. And then I would say consistency really matters. And we know that trust is built over time, especially when people can be skeptical and have a lot of questions. So being consistent in your messaging, the science isn't changing, so AAFP's recommendations aren't changing, and making sure that the patients know that they have a trusted partner in healthcare with their family physician. They know what's best for their health.
I think that's all such great advice. I love the reframing of the conversation instead of being reactive. And I would assume at times that's hard to do, right? To not just be reactive, but to take the step back and to reframe the conversation and to know that trust takes time. I think that's some great advice. Looking ahead to 2026, what are the top media and communication priorities for you? And how are you thinking about sustaining the momentum around the preventive care moving forward?
So we know preventive care remains a major focus, whether we're talking about immunizations, we're talking about chronic disease, we're talking about cancer screenings, making sure that patients across the country have access to a family physician that is a usual source of care that knows them and their family history and their health history. We're also looking at other things like ensuring that there is sustained interest in people becoming a family physician. We know that there's a shortage of over 40,000 physicians by 2036. So making sure that there are enough family doctors to take care of patients. Obviously, vaccines will continue to be in the news, and we will continue to be agents of truth and in making sure that people know that vaccines are safe and effective and save lives. And then also promoting issues that are important to physicians. So that does include things like vaccines, but it also includes maybe some wonky policy things that most media might not be familiar with. And when I say that, I mean things like administrative burden. So making sure that patients aren't overworked with paperwork and have time for patient care, making sure that primary care physicians are adequately paid. There's a lot of new technology underway. How does AI weave in with primary care? Those are all things that we're exploring and that the media is also interested in. But I would say that the bottom line is that elevating family physicians as accessible and trusted voices in an increasingly fragmented healthcare landscape and with a lot of media narratives going on is the ultimate goal.
These are great goals for 2026. They're big, but they're great. We wrap up every podcast with a couple rapid fire questions just so our listeners can get to know you. What is one small thing that brings you joy lately?
My brother has a golden retriever who is my best friend. His name is Eli, named after Eli Manning. And I just feel like dogs and golden retrievers because I'm obsessed. Just there's something about their goofy smile and it just brings me a lot of joy.
I have a golden doodle, so I completely agree with that. What are you currently obsessed with? Book, show, hobby, or idea?
So I have been binging since COVID, previous seasons of Survivor. And I watched it when I was a kid. And then in the pandemic, I just got deep into it again. And so I've been loving rewatching old seasons, especially the ones that took place before smartphones were invented and just seeing how the show has changed. And I know the 50th season is coming out soon. So I'm very excited to watch that.
Yeah, that's a good one. What is your ideal comfort food?
Pasta. All the carbs.
Yep. And what's one travel moment that still makes you smile when you think about it?
That's a great question. I think studying abroad in London in college and just walking around by myself and seeing all of these insanely old buildings. And I live in Washington, D.C., and so we walk down Old Town Alexandria, and it's like, oh, wow, these cobblestone streets are really old. George Washington might have walked here. But then you go to Europe and you see these cathedrals and something like Stonehenge, which are thousands and thousands of years old. So it's really powerful.
Yeah, that's great. Well, Julie, thank you so much. This was a great conversation. I feel like you have such good insights and real practical, ideas for people who are listening that can just, put them into place today if they're dealing with issues like that you have. So I appreciate your time and your expertise. And thank you for joining us today.
Thank you so much for having me.
That's a wrap for today's episode. The Association Insights podcast, previously known as the Association 100 podcast, is a production of OnWrd and UpWrd Marketing and Communications, where our mission is to make associations and nonprofits the go-to source in their industries through earned media and thought leadership. This podcast is an extension of our newsletter, a bi-monthly collection of best practices, top trends, helpful ideas, and smart strategies delivered straight to your inbox. Have you undertaken a big change at your association? Or do you have some words of wisdom from the trenches of association life? We want to hear from you, and so do our listeners. Drop us a note at info@onwardupwrd.com. That's info@onwrdupwrd.com. Be sure to subscribe, give us a 5-star review, and share with your friends and colleagues. We're available anywhere podcasts are found. Come back next week for more association insights and inspiration. Thanks for tuning in.